Hello, my name is Charlie Salibi. I'm a psychiatric mental health nurse practitioner MSN student at Eastern Kentucky University. Today I would like to discuss my integrative review covering cognitive behavioral therapy and substance abuse. Substance abuse is an epidemic in America. In Kentucky, small towns like those where I'm from seem to be fighting a losing battle. Successful treatment options must be identified and implemented into current practice in order to get a handle on this local and national issue. Chances are someone watching this presentation right now have been affected by substance abuse in some way. I would like to look at how does implementing cognitive behavioral therapy into substance abuse treatment affect the rate of maintaining abstinence when compared to standard care. The evidence speaks volumes. In Kentucky alone, in 2016, there were 989 related opioid deaths. That's 23.6 deaths per 100,000 people, and that's more than double the national rate. Since 2012, heroin-related overdoses have increased from 143 to 311, and opioid-related deaths since 2012 have increased from 70 to 465. Right now, Kentucky has the third highest overdose mortality rate in the United States. We have to do something. I looked at the title model by Phil Barker when I was implementing my interventions into practice. I did 2 literature reviews. The first one was Internet-Delivered Treatment for Substance Abuse, a multi-site randomized controlled trial. The sample size for this study was 507 adult men and women entering 10 outpatient addiction treatment programs. They were randomly assigned to 12 weeks of treatment as usual or treatment as usual plus a therapeutic education system, which is an online form of cognitive behavioral therapy. This intervention was substituted for 2 hours of standard care per week. The study focused on abstinence and retention. Abstinence was measured twice per week by urine drug screen, followed by a checkup at 3 and 6 months. Treatment retention was measured by staff members tracking individuals. The intervention group showed more total half weeks of abstinence at 11.8 weeks of abstinence versus the treatment as usual group, which was 8.8 weeks of treatment as usual. Overall, there was less dropout in the intervention group as well. Study findings revealed that those receiving the online cognitive behavioral therapy increased the odds of abstinence by a factor of 1.62. Study 2 was very similar in some ways. This was a web-based behavioral treatment program for substance abuse disorders at partial replacement of standard methadone maintenance treatment. So there was medication treatment involved in this standard care. The sample size was 160 adult men and women, divided into a randomized control trial to evaluate effectiveness of web-based cognitive behavioral therapy when partially substituted for standard counseling in the community-based program treating adult men and women addicted to opioids. This was a 12-month study, and it was at a methadone maintenance treatment facility. This study also focused on abstinence and retention. Drug abstinence was measured by a weekly urine drug screen, and treatment retention was tracked and measured by staff members. This study also found the intervention group had significantly greater percentage of overall abstinence, and the number of weeks participating in urine drug screens was greater in the intervention group. So overall, another positive outcome from this study. So how can these literature reviews that I've done improve psychiatric mental health nursing practice? Cognitive behavioral therapy has improved outcomes and length of abstinence in both studies that we reviewed, so we see that it works. Cognitive behavioral therapy is affordable. It can be implemented alongside standard care, even standard care that is established with medication-based therapy. Cognitive behavioral therapy can also be completed from home. For those patients through online programs, this could grant access to a larger volume of patients and would allow us to treat more patients simultaneously. Also, the web-based cognitive behavioral therapy allows a lot of flexibility for patients. This is important in those patients dealing with addiction who are on the road to recovery. Cognitive behavioral therapy could work for patients walking in the door for their first day of treatment or for those in the stage of recovery where they're back in the workforce and they are trying to manage everyday lives. The online therapy allows those patients to decide when to do their therapy and makes it more attainable for them to actually complete their sessions. So how do we implement this change in nursing practice right now? We can implement a web-based program at a local outpatient treatment center. We could follow patients for 12 weeks and review outcomes, and if it's positive, like we've seen in the previous studies I've talked about, then we could go ahead and implement that into practice. We can also offer cognitive behavioral therapy in group therapy or one-on-one sessions during weekly appointments, so that way those patients don't have to travel more if online cognitive behavioral therapy is not an option for them. There's a local clinic in Lexington called the Beaumont Behavioral Health Clinic. There's a psychiatric mental health nurse practitioner already on site who's treating opioid and substance abuse right now, so standard care is already established. This would be a great location to roll this program out and go ahead and start implementing these interventions into practice. It's vital that advanced practice nurses are prepared to treat patients with substance abuse. Regardless of the setting that we're going to be working in, we will come across someone who is facing substance abuse or whose family members are facing substance abuse. Advanced practice nurses are going to be at the front line of stopping this epidemic and at the very forefront of this fight. Cognitive behavioral therapy is an ideal addition to standard care, and it can vastly improve the outcomes of those patients facing drug addiction. Thank you so much for taking the time to listen to my presentation. If you have any questions, email me at charlie_brown110@mymail.eku.edu. Thank you.